Good morning. I'm Amy Smallers, Director of Healthcare Education and Professional Development at the Massachusetts Health and Hospital Association. And on behalf of MHA, welcome to today's Executive Insight Series session. We're thrilled to be continuing this series, where we've hosted nearly a dozen interviews with healthcare leaders on the most important topics facing our Commonwealth patients and caregivers. A few logistics before we start. We will be recording this session for those who aren't able to join us, and all lines will be in listen-only mode. If you have questions during the webinar, please put them in the chat feature. The questions will come directly to us, and we'll do our best to address as many questions as we can during the time we have together today. Following this webinar, we'll be sending out the recording along with a brief survey. I want to take a minute to thank our 2023 sponsors for their support in underwriting MHA's education programs. In particular, I would like to thank today's program sponsor, Robinson & Cole. Robinson & Cole is an AM Law 200 law firm established more than 178 years ago, with a deeply rooted culture of collaboration, civility, and inclusion. They serve clients and markets across the globe, and their Massachusetts team is a valued partner in fulfilling our mission here at MHA. I will now hand it over to Kate Healy, partner at Robinson & Cole, to say a few words.
Good morning, everyone, and thank you very much, Amy. We at Robinson Cole work with a number of healthcare providers across the Commonwealth and are grateful for opportunities like the conversation this morning that afford all of us a chance to think more about important healthcare policy issues. Thank you, David and Steve, for leading us in this important and what promises to be an insightful discussion. Steve, I'll now turn it over to you.
Thank you, Kate. Thank you, Amy, for your work to set up today and all your work on behalf of our education programs. And Kate, thank you for your sponsorship, but more importantly, for all the partnership and work you do with our members. It is critically important. I appreciate the role that you play in helping them be able to deliver needs to their communities and their patients. And thanks to everyone who's joined us in what promises to be a great conversation this morning. If this is your first time with us, MHA's Executive Insight Series is our chance to have a morning cup of coffee and check in with hospital and healthcare leaders throughout the Commonwealth. Since we started this series 2 years ago, we've heard from hospital CEOs in every corner of the state about their career journeys, the issues and opportunities they are navigating, and their vision for the future of our system. Now today, we're breaking the mold and we're moving outside of our membership for the first time. And we are honored to have one of the best healthcare policy minds in the nation joining us, David Seltz of the Massachusetts Health Policy Commission. David has been the steady hand leading the HPCA since its inception a decade ago when the Commonwealth's landmark law and cost control, Chapter 224, was passed. For those who are not familiar, the Health Policy Commission is the independent state agency charged with monitoring healthcare spending growth and providing data-driven policy recommendations around care delivery and payment reform. Under David's leadership, the agency has overseen the evolution of the cost growth benchmark and served as the primary resource on care affordability on behalf of Massachusetts patients. The HPC has also taken on a tremendous body of work around health equity, utilization trends, and now, most importantly, the healthcare workforce. Through his work, David has helped turn the agency into a model that other states have followed, and he has been personally a tremendous partner for MHA members and for me every step of the way. David, thanks for your ongoing leadership, thanks for your friendship, and thanks for joining us this morning.
Good morning.
With David, I want to kick things off. Now, your run at the helm of the HPC may be the centerpiece of your career to this moment, but you didn't start there. Can you walk the audience through your background, some of your experience at the State House? And I know you're not from Boston. What ended up drawing you into healthcare, and how did you make the jump to the HPC?
Well, good morning, Steve. Good morning, everyone. It is really an honor to be here this morning with you. I have my cup of coffee with me. I want to thank you, Steve, and your team for putting this great series together and for inviting me. And also want to thank the sponsor, Robinson Cole, and also, Steve, through you to your board and your board chair, Chris Schuster, who I think is watching and listening. And thank you for your partnership. Looking forward to a great conversation. So you kind of kicked me off by asking a little bit about my career and my history, and I have just been so fortunate to work in the most incredible field, which is healthcare policy, in the most incredible state for healthcare policy, which is Massachusetts, for nearly 20 years. I started my career as a fresh graduate from Boston College. You were right, Steve. I grew up in Minnesota, but came out east to go to college. And as a fresh graduate, my first job was working for the Senate Ways and Means Committee for the state Senate. And at the Senate Ways and Means Committee, which oversees the development of the state budget, every kind of junior analyst is assigned like a certain part of state government that they become an expert in. And when I started, there were a couple of different kind of accounts, as we called them, open at the time. And my boss asked me if I would be interested in working on the healthcare accounts. And I did not have a healthcare background per se. And I said, so, tell me a little bit more about these healthcare accounts in the state budget. Well, it turns out they're the biggest part of the state budget. And they're also some of the most complicated accounts because of all of the state and federal financing that goes into it. I asked if that position paid more if I took on healthcare accounts, and that was an immediate no. But I saw this opportunity to kind of take a risk on myself and to learn. And I'll be honest with you, Steve, at that moment in my career, I did not know the difference between Medicaid and Medicare. But sometimes the best way to learn is to really just be thrown into the deep end. And I certainly was. And through that position and working for an incredible leader in Theresa Murray, I learned so much, and we passed incredible landmark legislation in Massachusetts. I was able to be a part of the team that advised Senator Murray when we were negotiating Chapter 58, which of course became the forerunner to the Affordable Care Act, and got to work on numerous other pieces of legislation along the way, all culminating, of course, with the development and passage of Chapter 224. And in that role, I got to work very closely with you and your leadership as we passed that piece of landmark legislation. I'll pause here by just saying, working in the State House was such an incredible experience. And there is truly nothing like a late night when you work on a bill and you're leaving the building and the sun is rising and you look up at that Golden Dome. And it was really hard for me to leave the State House because I believe so much in the mission and I believe so much in the person I work for, Theresa Murray. But I also knew after the passage of 224, it was time to take on a new challenge. And the new challenge was, how do you go from developing legislation, kind of theoretical legislation, to then implementing it and making it real? And that has been the next part of my journey.
So I'll hit the rewind button with you. I share your love for the State House, spending 12 years there, 12 of the best years of my career too, the people that you meet, the opportunities to work alongside great people. And there were some late nights. I remember a night many years ago where you and I were trying to get a jacket signed at about 7:58. We had an 8 o'clock deadline, and now Speaker Mariano and your Deputy Director Colleen Alsamara was there, and Senator Moore, and we got it in under the wire, so to speak, which often happens. As you know, a deadline is when things happen in the State House. So now it's a decade later. We're removed from Chapter 224 and the creation of the agency that you ended up taking the helm at. Can you take us back? What were your main goals when you got to the HPC? And what have you seen in the evolution in the 10 years since, both in terms of your day-to-day mission, but also in healthcare itself?
Yeah, well, we started off with a massive challenge. Bending the healthcare cost curve, addressing healthcare costs is really, really hard. And I never want to diminish how hard Chapter 58 was in terms of getting everyone access to health insurance. But bending the healthcare cost curve is just as big of a challenge. When we passed this law, Massachusetts was the most expensive state for healthcare in the country. And the United States is the most expensive country in the world when it comes to healthcare. And the challenge was, when we have rapidly growing healthcare costs, it crowds out the ability for government, for families and individuals, for employers to be able to make investments and put their resources in other places and other priorities. And I just truly believe, and I think the motivation behind this legislation is that no Massachusetts resident should have to choose between being able to put food on the table versus going to a doctor. And so healthcare costs and affordability really matter. And so when we were first starting this agency, I think some of my priorities were, well, the first thing I did, Steve, is I developed an advisory council. I knew how important it was going to be to bring and maintain the commitment of this broader coalition, the commitment of the provider community, the hospital community, the health plans, the business community, the advocates. So many different people were a part of the advocacy of getting that bill done. And how do we maintain those relationships in order to help guide this work moving forward? So the first thing I did was set up a 30-person advisory council. I think the next thing I did was hire two incredible people to help me lead this organization, Colleen Elstemeyer and Lois Johnson. And they have been my partners in this journey for the last 10 years. I think in terms of some of those early priorities, and I'll probably mention this again and again, but it was so important to be able to build our data infrastructure. We really wanted this agency, this independent agency, to be really driven not by politics or ideology, but by the data. And so that really required an investment in our resources and our staff to be able to become the most sophisticated state in the country when it comes to our healthcare data. And that has been a foundation for everything that we've done over the past 10 years. Big picture, 10 years later, how have we done? Well, we have, our rate of healthcare spending growth has been below the comparable US average 9 out of the last 10 years. And we're no longer the most expensive state in the country. We're number 3, but that's progress. And I think more importantly, we've been able to maintain that shared commitment amongst all the stakeholders. And that's evidenced, I think, every year by the cost trends hearings, when we have incredible leadership from across this community participate in the dialogue about how we move this forward. You asked about evolution. I think evolution is really important in this field, because healthcare is just always rapidly changing. And I think one of the strengths of the Health Policy Commission has been our ability to be nimble and to be responsive to the most important questions of the moment. For example, I think of our role in providing objective data and analysis about the ballot question a few years ago around nurse staffing ratios. And we used our independent research and data to really provide, I think, information, really helpful information to the public about what the potential impacts could be. And I know that report was cited by Governor Baker and others as really important and as a trusted resource for their decisions. I think that the biggest evolution that I want to pick on, though, is the evolution of really being thoughtful about embedding health equity into all of our work. And I think this has been an evolution of not just the HPC, but really about our entire healthcare system and the health policy conversations. We actually literally changed our mission statement to say our mission is to advance a more equitable healthcare system for the benefit of all residents of the Commonwealth. Steve, in your leadership, I know that you've made health equity central and embedded that within MHA and your policy agenda as well. And I think that's just been a really important evolution and something where we're going to be continued and committed to doing that. I know we're going to talk a little bit more about some of the other pressing issues of the moment, but to round this out, to say evolution, flexibility, being able to be responsive, those are critical in a rapidly changing environment.
Yeah, I want to thank your leadership on health equity. I mean, I think we have been saying collectively, this is no longer a tomorrow problem. This is a today and every day challenge, and one that we should be taking on head on. So for you and the commissioners, thank you for that. Also, the advisory council. I mean, you've really done an incredible job with that. I've had the pleasure of serving, as has Chris Schuster, a number of our other board members. And, sometimes you're a listener, sometimes you're a counselor, sometimes you're a referee, but you always do a great job helping guide us and list the information that you need. Give me one thing. 10 years, we had chart programs, all sorts of interesting things that you've done. Is there one thing you're most proud of that you say, wow, that's a really cool thing that we did at the HPC?
This is going to sound a little schmaltzy, but I think the thing that I'm honestly most proud of is the team that we've been able to build, and the professionals who have come and worked for the Health Policy Commission, who are so dedicated to our mission. The work is incredibly important, and I'm so proud of. You can't ask me to pick a favorite child in terms of all of the incredible programs and research papers and these things that we've done, but it wouldn't have happened without an incredible team. So that to me is the thing I'm most proud of in this career.
Let me jump to your team now. I was going to talk about it later, and I have the pleasure of working with them, and they are tremendous public servants. And so you have assembled a great team. But the culture of the HPC, people really enjoy working there. You've created something. There's a buzz. There's something special. Doesn't mean on the soup du jour, an issue of the day, whether you and I might agree or disagree, but the staff is focused. They're mission driven. They're proud of what they're doing. What are you doing there? What's the secret sauce? What are you creating that I see folks start as interns or fellows, and they come out, they're going off to do great things, or they're staying at the HPC for, years beyond what most people stay at a job. Talk a little bit about it. What are you doing at the HPC?
Yeah, well, on this one, Steve, I am going to give all credit in the world to my deputy executive director, Colleen Elstenmeyer. She was the person that I first approached to be my partner in this endeavor, and it's really her who has created the culture that you talk about. And I thank you so much for all those kind words, and I absolutely agree. But it starts from her. And it starts from her building of a culture that really emphasizes high performance. We really emphasize learning and curiosity. We have, even now when we're in the kind of this hybrid world, when we're all in the office together, we really spend time doing all staff research presentations and discussions. We'll have outside speakers come in and speak with us and talk to the entire staff. Everyone who works here, from the front desk to the corner office, is a part of those conversations. And we're humble, a culture of humility. But I think the most important thing is just being laser focused. And Colleen really leads on this about our mission. And I think the mission is one of public service. It's one of sacrifice in a lot of ways to contribute to something bigger than oneself, and to try and make the lives of Massachusetts residents a little bit better in any way that we can. And I think that focus on mission, the focus on integrity, the focus on learning is really what has enabled this team to be such a high performing team, and one which, again, maybe sounds less humble, but I do think is one of the, the premier, kind of government agencies and staff in the entire country.
Yeah, and I'm glad you mentioned Colleen. Certainly haven't had a chance to work with her. She is a special person. I'm glad she remains so engaged at the Health Policy Commission. I got to get out of the micro for a minute. Let's go to the macro. Let's talk nationally. What are you seeing people doing? I know a lot of states have looked at the benchmark. Some are doing the same, some a little different, some trying to evolve it. What are you seeing there? And then let's just talk about the future, because we're going to have to think about affordability maybe a little differently. So what's happening around us? And then let's dive into what else is out there.
Yeah, it's been a really interesting few years, because the Massachusetts model and this model that we created, that you helped create in Chapter 224, has really taken off in many other states. So there are now 8 other states that have something similar to a benchmark or a target for total healthcare expenditure growth. Most recently, California joined this cohort of states, and as part of their legislation, they actually have a new office. It's called the Office of Healthcare Affordability. which in many ways has a lot of the same functions and responsibilities as the Health Policy Commission. So today, as we sit here, if you add up all of the people who live in those 8 states, 20% of US Americans live in a state that has some type of healthcare benchmark. And I think you pointed out something really important and interesting, and one that I have been thinking about, especially as we, have just celebrated our 10-year anniversary, which is, how do we evolve this approach? How do we adapt it and change it? And I think the other states have been really kind of interesting and instructive in ways that they have, in some cases, gone beyond what we've done, in some cases, doing it just, in a slightly different way. And I think there's opportunities to learn from that. And, I'll just to pick 2 as an example. Many other states have introduced this idea of primary care investment targets alongside their healthcare cost growth benchmarks to say, it's not just about kind of reducing overall spending growth. We also want to make sure that whatever that spending is going, it's going into places of high value. So they're actually setting targets for increasing the proportion of the healthcare dollar that's going to primary care. And I think that's a really interesting idea. A second interesting innovation to me is California, because as part of their statewide benchmark process, they are actually authorized under their enabling statute to develop different benchmarks for different healthcare sectors. And I think, or different geographies or different entities. I think that's a really interesting concept as well. And the last, I think, evolution or kind of wrinkle that we should really learn from other states is how they're really incorporating the pharmaceutical sector into these efforts. Many other states have gone way far beyond where we are in terms of increasing the transparency and accountability of the pharmaceutical sector. And I think that's really important for us to do as well here in Massachusetts. So I think great opportunities to learn.
Not good or bad, just we might have missed that 10 years ago. That may have been a piece that should have been included initially, and we can think that through. Be interesting to see on the primary care whether there's some cost avoidance that ends up making patients healthier and saving money as we see more data on that. I think it's a good idea and one we've been talking about. Let's talk about delivery. So you've been talking about mobile internet health, telemedicine, hospital at home. Are we going to blow this up? Like, we have to deliver care outside of the walls of the hospital. Seems odd for a hospital association leader to say more care other places, but right now we have capacity challenges and workforce challenges. Do we have to think about the delivery system and change the model in the next several years?
I don't think there's any doubt, Steve. And I think that, and I think all of the health system leaders are really thinking about that and being innovative on that. And for all those innovations, many of them are being driven by some of our, our big systems, but also some of our small community hospitals. Everyone is evolving and changing. I think the change and kind of shift in site of care has been one of the most, kind of rapidly evolving dynamics in healthcare. And whether that's coming from the hospital to the hospital outpatient or into the community, whether that's thinking about the rapid, deployment of telehealth, especially for mental health services, we do need to think differently about how we deliver care on a macro level, but also on a micro level. And to me, this goes to the massive workforce challenge that we have right now. These two things intersect because right now we have a healthcare system that is really challenged in moving patients through to the right place at the right time. We have 50% of patients who present in an emergency department with a mental health condition end up boarding in that ED. How many patients are currently been waiting in a hospital, sometimes for 10 days, 20 days, 30 days to get a placement in a skilled nursing facility. So it is going to require innovation. It's going to require change. And I think we're the right place in the right state to do it.
Yeah, and it's not good for our patients, right? I'll come back to workforce in a second, but I want to grab one out of the chat here because it has to do with site of care. What about CVS, Amazon, other entities? Are they a good thing for us, a bad thing for us? Should we be learning from them, scared of them, welcoming them? Where do you see them fitting into our infrastructure?
I think it's still a little early to say. That the history with Amazon in particular and some of their healthcare acquisitions has not been a particularly successful one to date. I do worry, I guess, a little bit about the breakdown of, the trusted relationship between, your physician, your care provider, and patient care, and, disruption of care. We've put so much emphasis around coordination of care, around being able to understand the whole person needs of patients, of moving towards thinking about the integration of physical and behavioral health care, of thinking about social determinants of health. And I think, the health systems here in Massachusetts have been leaders on all of those fronts, especially with the Mass Health ACO program. So I do have some concern and worry about, these disruptive entries and what that's going to mean for patient care and what that's going to mean for some of the investments we've made over the past 10 years.
Yeah, and you and I haven't always agreed on Health Policy Commission powers, but I think this is one where we can align, and that, if they are here, they should be held to a similar standard as they're cherry picking commercial patients from some of our hospital systems that are contributing to their local communities.
Absolutely. I think our state law does need to be updated on this front to reflect, not just kind of these big, for-profit disruptors, but also the entry of private equity into healthcare. And that's another, rapidly evolving trend that we need to make sure that we have the right tools and oversight to be able to hold them to the same account that we hold everyone else.
We could do this all morning. I'm going to jump into workforce, and if someone has a question, throw it in the chat, and you and I can talk underwater. So I'll ask us to be a little bit brief on these, but you hosted a great workforce event. I mean, it really was an awesome event, and you featured leaders around the sector. I think this affordability issue, which is important to all of us, is really challenged by contract labor. Are there additional thoughts? What can we do here? You've seen our studies, 1.5 billion last year in contract labor. Really hard to focus on your mission and our collective mission to make healthcare more affordable with those kind of numbers.
Yeah, it's a massive challenge, Steve. And as part of thank you for your kind words about the event. And we highlighted that rapid growth in contract labor. And the pressures that it puts on the healthcare system and kind of the business and revenue side of the healthcare system. I still see and hope that we can do hard things, and that we can still think about ways of balancing the very real pressures and costs that hospitals and other healthcare institutions are facing, while not losing sight of our long-term goal around affordability. And from the Health Policy Commission standpoint, when we think about holding providers to accountable to the benchmark during this time period, we are absolutely going to be responsive and reflective of the fact that there were many costs outside of your control, and we're not going to be holding people to account for that. And so it's really still about thinking about our long-term trajectory, and I think we can find ways to work together.
And I want our members out there listening, David, to know you and I battle on this, right? We have this rapport with each other, and we approach these with respect and admiration. But I fight you on these because there's a lot of challenges that I think we align on, and some that have been difficult over the years. But we do it with respect and with trying to get to a better place. Give us your top 1 or 2 legislative priorities. I know you have a busy year as well at the HPC, things you're trying to move the ball forward on.
Yeah, so as already mentioned, I think there's some opportunities to look back at our statute, to update that, to evolve that based on some of the lessons learned over the last 10 years. We absolutely need to bring the pharmaceutical sector underneath this umbrella of accountability. I think there are ways that we could push forward on reducing the administrative waste and burden in our healthcare system. There's some big priorities. I am very excited for this legislative session and for working with the Healy-Driscoll administration. I think we're going to get a lot of great stuff done.
And we have a lot of emerging leaders on the call. They always are. It's been a nice series for them. Give us a little bit of advice. What you say, the emerging leaders in healthcare, it's such a difficult time out there that are entering this field.
I guess my advice is to take big risks. And if you fail, hold yourself accountable, but then take another big risk. That's been a hallmark of my career. And one that has served me well, and look forward to making a connection with all of the emerging leaders on this call. And please feel free to reach out to me. And Steve, this has been a fun conversation.
And I know how accessible you are, and I know you mean that when you say that. Really, you're really always there to chat with people. We could do this all morning, David. Our time is coming to a close. Your coffee is cooler than it was when we started. But thank you for being with us. We know that none of these issues are going to be resolved overnight. But we're proud to be your partner. We're proud to usher in this new era of healthcare with you. And we thank you for all that you're doing, and thanks for your leadership of the state. It certainly is making us a leader once again around the country, and it's because of you and the team that you've assembled at the HBC. To our audience, if you enjoyed us this morning, we host educational content every week of the year. We're especially excited about our upcoming Emerging Leaders Summit and our DE&I webinar series, which are shaping up to be can't miss events. Thanks for spending your morning with us and for all the work that you do on behalf of the Commonwealth's patients, caregivers, and communities. We look forward to seeing you at our next Executive Insights session, so stay tuned for more details. Have a great morning. And again, David, thank you so much for joining us this morning.